Good afternoon, class. This is going to be lecture 4 of the Emergency Medical Responder course for Wilcox County. In lecture 4, we're going to cover communications and documentation. Alright, brief introduction. Communications are important during every phase of the call. Dispatch must communicate the location and type of call to the responders. EMRs need to communicate with patients, bystanders, family members, dispatchers, and members of the public safety community. After the call, you must document the condition of the patient and the treatment given. Data and communication systems. The communication system is to send information from one location to another when it's impossible to communicate face to face. The results of using a communication system are only as accurate as the information put into that system. Communication systems can be divided into two categories: those that transmit voice and those that transmit data. Uh, Voice communication systems transmit voice from one location to another. Radio systems are regulated by the FCC, frequencies assigned according to the function of the organization. Types of radios are base stations, mobile radios, portable radios, and repeaters. A base station is a very strong radio that puts out a very strong signal. The mobile radio is typically found in vehicles and is stronger than a portable radio, but not as strong as a base station. Portable radios are your general two-way radios that are all completely self-contained. That's going to be what you talk on when you're out on a scene. And a repeater is a receiver that takes in a weak radio signal and amplifies it and automatically repeats it. Voice systems, telephone systems, primary send voice communications. Landline phone systems are tied together through above the ground hardwire system. These are what we used to have in our homes growing up. Most people don't even have landlines anymore. I know I haven't had one in 10 years. Mobile phones rely on radio waves between a mobile phone and a cell tower to send and receive voice data. They're great, they're convenient. Sometimes they don't have the greatest reception, especially in rural areas such as our county. And sometimes it's very hard for dispatch to pinpoint the location of a caller using a cell phone. So that's your downfalls to the cell phone. Data systems. Data can be transmitted through radios, phones, or the internet. Paging systems can transmit text messages or voice communications. Mobile data terminals or MDTs transmit data messages through a radio system. Fax machines use phone lines to transmit written data. Telemetry is used by ALS units to transmit EKGs and other patient data to the receiving hospital. Digital messages include email, text, and can be used to transmit a wide variety of messages. The function of radio communications. Dispatch may use voice, text, and/or MDT to alert responders to an emergency. It's your responsibility to keep your equipment ready to receive a call when you're on duty. If you are not sure all the info has been received correctly, ask the dispatcher to repeat it. The functions of radio communications. Response to the scene. You need to learn to use maps or GPS to respond to the scene in a timely manner. Always know where you're going before you get started. The dispatcher may give you more info while en route. If you're delayed or encounter problems, please notify dispatch. They may be able to facilitate a different route for you to get to the scene and/or provide you with additional information that can help you get where you need to go. The functions of radio communications, part 3. Arrival at the scene. You want to perform a visual survey of the scene. Give dispatch a brief verbal description of the scene, location and type of incident, any hazards that may be present, number of patients, any additional assistance that may be required. It's always a good idea to go ahead and request additional resources. If you don't need them, you can always cancel them. But if you go ahead and get them started, then they're on the way and you don't have to try to get them there later. I'd always rather have more help than I need and just send them home later. Functions of radio communications, Part 4. Update responding EMS units. Your report should include age, sex of patient, chief complaint, level of responsiveness, status of airway breathing and circulation. You may be on scene for several minutes before the EMS units arriving. Giving them a good solid report prior to arrival can let them get prepared for what they're going to be dealing with when they arrive on scene. It can let them know if they need to contact to get additional resources on the way. It's just very beneficial. You can also use your radio to transfer care to other EMS personnel if you can't do it face to face. It's a great way to give a handoff report. The functions of radio communications, Part 5. Online medical control is generally used by paramedics to secure permission to do certain skills that may be outside of the general guidelines. Get directions regarding patient care. Give patient care reports to the hospital. Like I said, this is generally going to be utilized mostly by EMTs and paramedics. However, you may find yourself in a situation where you need to contact your medical director directly. If you do, you just need to be aware of your current policies and procedures and be able to ask for permission to do whatever you're trying to do, in line with your guidelines. Verbal communications. Effective communication means that the person receiving the message understands exactly what the person that sent the message meant. Effective communication requires feedback. The receiver needs to communicate to the sender that the message has been received and understood. Both external and internal distractions can negatively affect communication. External distractions include noise and the use of electronic devices. Internal distractions include letting yourself think about unrelated matter when on scene. When you're on scene of a call, it's very important to stay focused. You don't want to let internal or external distractions get you off topic. If you're distracted, it can cause harm to you. It can cause harm to the patient. It can cause harm to other first responders or medical personnel. You just have to remain focused while you're on scene of a call. Effective communication with patients, Part 1. It's always a good idea to introduce yourself by name and title. Ask the patient's name and use it. As for the patient's, make and keep eye contact with the patient. Use language the patient can understand. Speak slowly and clearly. Sometimes patients are extremely upset. Obviously, given the situation, that's understandable. You always want to just make sure that you take that into account and be patient with the patient. All right, effective communication with patients, Part 2. Always tell the truth to your patients. Allow the patient time to respond. Limit the number of people talking to your patient. Be aware of your body language. Act and speak in a calm, confident manner. Like I've said multiple times, in several lectures, if you'll remain calm, everybody else is going to feed off of that and they're going to remain calm too. If you let your emotions get the best of you, things are going to go sideways really quickly. Right, effective communication with patients, Part 3. Always respect the cultural norms of the patient within reason. I say within reason, I'll come back to that momentarily. Use open-ended and closed-ended questions appropriately. Sometimes you want to ask a patient an open-ended question and let them explain the entire situation to you in their own words. Sometimes you just need a yes or no answer. You need to know when each of those is appropriate. Treat all patients with dignity and respect. You've always got to treat your patients with dignity and respect. It doesn't matter who they are, why they called. They deserve your respect. They're already having a bad day. Don't make it any worse. Let's go back to respecting the cultural norms. I put in parentheses within reason. I'll give you a quick example. Went on scene to a call one day, and it was for a cardiac arrest. And the family, when I got to the door, they told me I had to take my shoes off to enter their home. And this was a cultural thing. And typically, in a normal daily, situation, I would feel compelled to take my shoes off and, follow their, cultural norms. However, the situation was a cardiac arrest, and I'm not going to take my shoes off to go, provide patient care for a cardiac arrest. So you have to just, take into consideration sometimes it's not completely realistic to follow all cultural norms, but just do your best when you can. Communicating with patients with special needs. Patients who are hard of hearing or deaf is the first one we're going to talk about. Always identify yourself by showing the patient your badge or patch. Touch the patient to reassure them. Face the patient when you speak so they can see your facial expressions. Speak slowly but don't shout. Watch the patient's face for expressions of understanding. If all else fails, write down the questions. Communicating with patients with special needs, part 2. This is going to be about patients who are visually impaired. Tell the patients what's happening. Identify noises and describe the surroundings. Find out the patient's name and use it throughout your examination and treatment. If the patient has a service dog, try not to separate them. It's not necessary to talk louder. Just because somebody's blind doesn't mean they can't hear you. Sometimes we get caught up in the moment and think yelling at someone makes them more able to hear us. It doesn't. The reason you want to talk so clearly and explain what's happening to the blind patient is they can't see. If there's loud noises going on, if there's a lot going on in their home, you need to tell them what they're hearing and where the noise is coming from. So just keep that in mind with the blind or visually impaired patients. All right, communicating with patients with special needs, part 3. This is going to be for your non-English speaking patients. First thing you want to do is determine how much English the patient can speak, if they can speak any at all. If you can find an interpreter, that would be great. Sometimes family members, especially the younger children, are able to be interpreters. Supplement your questions with hand gestures, finger pointings, and facial expressions, similar to what you would do with a deaf patient. Sometimes that can help tremendously, and you can actually communicate through nonverbal communication pretty well. All right, communicating with geriatric patients. Guys, this is something we really have to keep in our mind. Don't assume that all older patients have physical or mental impairments. Assess all patients carefully and give them time to respond to your questions. Uh, Generally, you're going to approach an elderly patient just like you would anybody else. Just because they're old doesn't mean that you have to treat them any differently. You have to take it on a case-by-case basis. Obviously, some elderly people are harder of hearing. Obviously, some have visual impairments, but not all. That's just like any age group can have different impairments that we have to take into consideration. But don't assume that just because somebody's older, they have certain impairments. All right, pediatric patients. This is a big one just because pediatric patients can be a huge source of stress for providers. Um, Sometimes familiar objects and faces can reduce the stress and fear in children. Talk to the parents and the child as much as possible and tell them what's happening. Ask a parent to hold the child if the illness or injury permits it. A lot of times that'll just calm the whole situation down. The child feels secure, the parent feels less out of control, and it just makes the whole situation better. Tell the child your name and explain what you're doing. It's always a good idea to squat, kneel, or get down on the same level with the patient and establish eye contact. Be honest with your patient. Tell them what's going on. Never lie to a child, because if you lie to them and then you cause them pain or hurt them, you have lost their trust and they're not going to trust you anymore for the rest of the encounter. It's always best just to be honest with them. Communicating with patients with special needs, Part 5. Developmental disabilities. Ask the family about the patient's typical level of communication. Use the family as a resource. The family interacts with this individual every day. They know more about the patient than we do. Speak slowly, use short sentences and words. You may need to repeat or rephrase statements several times until the patient understands what you want. A lot of times you're going to have to treat these patients very similar to you would children. Just keep in mind that you can use some of the same techniques on different populations. And use your family as a resource on these patients. It's invaluable. Alright, let's talk about persons displaying disruptive behavior. The biggest part of this situation is to try to assess the situation and try to determine the cause of the patient's behavior. Number one priority for you is also to protect yourself. You can't take care of anybody if you're not, taking care of yourself. You got to stay between the patient and the exit of the structure. Don't ever let them get between you and the exit. You always need to have an escape route. Don't take your eyes off the patient or turn your back. If the patient has a weapon, stay clear of the scene and wait for law enforcement. You cannot take a disruptive patient to the hospital just because they're being disruptive. I mean, obviously, if there's some type of mental illness and they're, not able to make decisions for themselves, that's a different situation. But you can't take people to the hospital just because they're, causing problems. That could be a law enforcement issue, but that's not something that you can do just for that reason. So just keep that in mind. Gonna hit briefly on medical terminology. There's a whole section for it, so we're not gonna get too in depth in it here. Medical terminology is a collection of technical terms used by medical professionals to identify anatomic parts of the body, specifically, specify illness and injury, indicate what treatments have been given. Medical terminology, part 2. Your job as an EMR is to communicate your message to other medical providers as clearly as possible. Do not use medical terms if you are unsure of their meaning. As new medical terminology is introduced, look at each part of the word. Learn common occurring prefixes and suffixes, as they can help you understand a new word. Documentation. Documentation is a process for verifying your action using written records or computer-based records. Proper documentation includes the age and sex of the patient, the history of the incident, the condition of the patient when found, the patient's description of the illness or injury, the patient's chief complaint, level of responsiveness, initial and subsequent vital signs, results of the physical exam, pertinent medical conditions, and sample history. Also, the treatment provided. Proper documentation is going to be continued here. Any change in the patient condition, the agency and personnel that took over the care. The following times need to be included. That's your dispatch time, your on-scene time, the time EMS arrived on scene, the time the patient departed the scene. Complete your PCR as soon as possible after each call. The longer you wait, the more you forget. You don't want to omit anything in your report, so it's best practice just to immediately get started on documentation and knock it out. Your job's not done until all your paperwork's done. Alright, summary guys. Communication systems allow you to relay information from one location to another when it's impossible to communicate face to face. Excellent communication skills are crucial during every phase of the call. You must have a basic idea of how your department's communication systems work. You must be familiar with two-way radios, uh, communication, and having a working knowledge of mobile and handheld portable radios, when to use them, and what info can be transmitted. Communication systems are used for different functions. The phases of an EMS call include dispatch, response to the scene, arrival at the scene, updating, responding EMS units, transferring care, and post-run activities. It's important that you learn and follow the standard procedure and protocols used by your department for communications. In addition to the radio and oral communications, you must have excellent person-to-person communication skills. Body language and attitude are very important. You must take special care of individuals such as children, geriatric patients, hearing impaired and visually impaired patients, non-English speaking patients, developmentally challenged patients, and patients displaying disruptive behavior. Along with your radio report and oral report, you must complete a formal written report that will be given to the EMS professionals at the scene.